Reunification therapy, a vital component of family therapy, holds immense promise for repairing strained parent-child relationships and addressing issues arising from parental alienation. This therapeutic approach is particularly valuable when families navigate challenging dynamics due to divorce, separation, or other factors impacting the parent-child relationship. At its core, reunification therapy is designed to rebuild and strengthen the connection between a child and a parent, especially in cases where parental alienation may have occurred. Parental alienation involves one parent influencing a child to reject the other parent, often resulting in strained relationships and emotional distress for all parties involved. A skilled reunification therapist is pivotal in guiding families through this delicate process. They help bridge the gap between the child and the previously alienated parent, fostering an environment conducive to rebuilding trust and understanding. This is how reunification therapy works. Firstly, an initial assessment. Reunification therapy commences with a comprehensive assessment by a skilled reunification therapist. This professional evaluates the entire family dynamic, identifying factors such as parental alienation, abusive behaviors, or intense marital conflicts that may have disrupted the parent-child relationship. Setting the stage. The reunification therapist creates a safe and neutral environment for all people involved. This setting encourages open communication and sets the stage for positive relationship building. Individual sessions. Individual therapy sessions may be initiated for the child, the alienated parent, and the favored parent. This personalized approach addresses each individual's unique needs and concerns, ensuring a holistic understanding of the family's dynamic. Exploring negative beliefs. The therapist delves into the favored parent's negative beliefs, working collaboratively to challenge and reframe them. This process is pivotal in reshaping perceptions and laying the groundwork for a healthier relationship. Family reunification sessions. Structured family therapy sessions unite all family members, providing a platform for open dialogue. The reunification therapist facilitates discussion, guiding the family towards understanding and rebuilding connections. Child-centered approach. The therapist maintains a child-centered focus throughout the process, considering the child's feelings, pace, and unique needs. Addressing underlying issues. Reunification therapy does not shy away from addressing underlying issues such as substance abuse, emotional dependency, or poor parenting. Court involvement. In some cases, reunification therapy may be court-ordered, especially with high-conflict divorces or allegations of child abuse are present. Reunification therapists may work closely with the legal system to ensure a comprehensive and supportive approach. To learn more about reunification therapy, go to our Carepatron website or click on the link in the description. We have a range of guides and articles to help you learn more about different therapy techniques to incorporate into your practice. Carepatron is a healthcare platform designed for you. Signing up is free. Just click on the link in the description. If you enjoyed this video, don't forget to hit the like and subscribe button for more content like this.